Hi, I'm Debby Farkas, Production Manager of Curriculum Development at Weiser. Today I'm speaking with Dr. Christopher Schott, a course director of several Weiser courses. Thank you for coming to speak with me today, Christopher.
Hi Debbie, how are you?
Good, how are you?
Good.
Can you please tell me a little bit about the courses that you run at Weiser?
Sure. So the first course that I created on my own was the point of care ultrasound course. That started in January of 2014 with our first offering to students. And it was a course that's designed to introduce students in the use of ultrasound to augment their patient care at the bedside so that they're able to not only understand pathophysiology but actually see the pathophysiology in patients.
Okay, thanks.
I also took over for the critical care elective that the School of Medicine offers, and I've been running that since January 2014 as well.
Okay. How does Weiser support you while you run your courses?
In terms of the critical care elective, that's a course that requires a lot of ability to adapt on the fly. As the students are performing resuscitations on the high-fidelity mannequin, it's very important that the sim specialists are able to respond appropriately and adapt to whatever interventions the students have done, whether it be the correct or incorrect ones they can learn from and see what their actions do on a simulated patient. That also requires a lot of preparation up front in terms of knowing what the cases will be that day and anticipating what their actions would be. In terms of my ultrasound course, that does require a lot of physical room setup in order to maintain privacy for the standardized patients that come in, as well as having the ultrasound equipment ready and having the simulated course materials that I've developed ready to go as well so that it can run smoothly for the students to practice ultrasound.
What type of course material do you have for your point of care ultrasound course?
With that course, I designed it as a flipped classroom design where the students prepare ahead of time watching online content to kind of get the cognitive aspects of the course prior to coming into the workshops. So I have the videos for each section loaded onto the Weiser website, and the students are expected to review the material before the workshop. Then when they come in, they can start right off the bat performing the hands-on or psychomotor aspects of the course, scanning on a standardized patient to see normal anatomy. And then in the second half of the workshop, I introduce simulated cases where I show them pathology based off of stock clips that I have, so they can learn how to integrate their findings into clinical decision making. They then go off and perform scanning in clinical scenarios. So I try to develop in a way that it emphasized high utility or high yield of the instructor's time when they're here at the Weiser.
Sure, thanks. Can you please describe the process when you have to update course material?
Sure. The course that I teach that uses the most online material is the ultrasound course. And it's relatively easy to make changes to it. Each block, for example, I have a different set of pre-test, post-test questions that I ask so that students can't learn and share the answers. So it's relatively easy to be able to select what tests to offer and administer, what questions to use from a master question bank. And that's a specialty in particular that has a lot of evolving information. So when there's new articles or new information to put out, it's pretty easy to just go ahead and load it onto the site so that the students have the most up-to-date resources to have access to.
Great, thank you. Is there anything else that you would like to add about your courses?
I think one of the advantages of offering both the critical care course and the ultrasound course is I think ideally it'd be nice if students could take both so that in the critical care course they can learn the pathophysiology in a simulated environment, and then when they take the ultrasound course they can actually see the pathophysiology. So I think ideally it'd be nice one day if we had the resources to be able to offer enough spots, particularly for the ultrasound course, to grow that in future years so that students would be able to take both.
Okay. Thank you, Christopher, for taking the time to speak with me today.
You're welcome.
Thank you for listening to this Weiser Minute. For more information, you can go to our website at weiser.pitt.edu.